Hey everyone, and in this video I'm going to talk about a case which has been on my mind for a while. This gentleman in late 60s was diagnosed with glioblastoma last year, and of course he has been going through a lot. He has triplets, all grown up. He's a very supportive wife. He had been getting chemo, have had many seizures, and he's severely depressed. And I, as a primary care internist, my role has been more or less supporting. But he comes to see me every 2 months at least, because he feels that I make him feel better more than medication. So I saw him today because recently he was visiting his relative who he loves in Pennsylvania, and his son accompanied him over there, and he was very happy to have spent some time with his family member who he has not seen for many years. So, but this stress of traveling and some disruption in sleep was weighing on him. So when he came back, he developed seizure, full-blown grand mal seizure. Paramedics were called. He was taken to the hospital. They adjusted some medication. They added a medication for him, but he didn't want to take it because of the side effect. He's already on one. So he wanted me to jack up his antidepressant. And of course, he's quite depressed, and he has been depressed for a while. And during this process, he always asked me, why me, why me? This why me loop is very difficult to get rid of. And I just definitely don't want to push him and invalidate his feeling. So I usually tell him that it's normal to ask, why me, and things just happen to people. Sometimes we don't know. And people with the glioblastoma, usually diagnosis is, or prognosis is not good. But people go through this neurochemical changes causing depression, and they have a cognitive rigidity where they're stuck with painful thought, why me? And they feel tired, and they have a total loss of control, particularly after seizure, So my during my conversation, I will tell him that it's okay to feel that way, but you need to just take one day at a time. In the beginning, I used to tell him that I stay positive and this and that, but I've stopped saying that because I felt that it was invalidating his feeling. So I changed that. I said, well, let's just take one day at a time. I'm here for you, and you got a great wife and great kids, and you need to start doing things which make you happy. So let's take today and one step at a time and make small changes. Do small things which make you happy. I think that I have been trying to tell him that life still matters, whatever time he has. So that I want to shift his thought from why me to do small things, whatever time he has. Make every day a little bit better. Do things which makes you smile in a very meaningful way. he got an incredibly supportive wife. Just it's amazing to have a partner like her. She's amazing, actually. He has cried many times in my office, um, and it's hard to see that, actually, because he knows in his heart that his life is limited. Um, and I encourage his wife um, to be strong and share some old family pictures, kids' picture, celebrate small victories, um, and help him anchor to the living world. Patients often feel like a burden in this situation. They feel like life is passing by without them. Um, it's like they're watching the world from the rear view mirror. Um, so today I definitely jacked up his medication for his depression, and I told him that he does not need to add another medication for seizure. I believe that his seizure was because of the his trip and stress on him, and he has neurology appointment. Um, and I've not spoken to him about palliative care. Actually, one of these days, I do have to ask him about palliative care. It's gonna be hard, but it's really important for people with depression and anxiety, because palliative care is not a hospice care. It's a support system for any patient with cancer. I told him to create some routine, go for a walk every day, um, and with his wife, listen to his favorite music, go to some concert, his favorite singers, some breathing exercise, go in the nature. The positive feelings is very good for your body and soul. Um, and this kind of routine helps you in your psychological scaffolding. Um, and so, it is, this is the best as a primary care doctor you can offer. Of course, I offered him to see a psychiatrist, but he declined. And so short, small things, simple walk, watching a movie, reviewing your pictures of your children and yourself, see the life's journey, and um, spending some great time finding that comfort, dignity, and connection and meaning. The present moment is the best way to help your patient with. And you wish you can change everything magically, but we are all limited in what we can do. I wanted to share this story. Um, Sometimes it's very hard, difficult to go through um, with patients. Sometimes I think the doctors, if you are really caring about the patient, you can feel their pain, because you never know. Life is short, things can happen to anyone. So enjoy your life every day, celebrate it every day, live your life with kindness and love. Thank you for watching.